Hey everybody, I just wanted to touch in and touch base with you. It is, what's today? Wednesday, March 9th. Today is the last day of radiation. Woohoo! Super, super excited about that. Sorry, try to hold the phone still. Um, so radiation has been going okay. I've got lucky and really no skin problems, just a little redness, but no blistering or anything like that. Those of you who've started radiation or going through radiation, be aware that the fatigue is real. Of course, it's nothing as bad as chemo, but it does wear you down and you get pretty tired pretty quick. So I had 15 treatments. Um, yeah, today's my last day. Actually, yesterday was supposed to be my last day, but Monday they had to cancel because the machines were down, so they postponed it today. So I'm super excited about that. So all the big treatments are behind me, and now I just have to continue with immunotherapy every 3 weeks until August. So the immunotherapy, it's Herceptin and Perjeta, which are two drugs that are used for my type of tumor, which is ERPR negative and HER2 positive, and these drugs help the tumor not to come back. So the infusions every 3 weeks, those aren't a big deal, just time consuming. So yeah, just wanted to update you on that and anybody going through it. Radiation, it's like the last step of treatment, sort of. So yeah, that's all I got right now. I also wanted to just give a little just let people know, one, if you're going through cancer treatment, and then two, if you have a loved one that's going through cancer treatment, even if you're at the end, kind of close like I am, and you've been deemed cancer free, yay! Just realize that there are still a lot of emotions that go along with it. Even though you get a call, you're cancer free, you're happy, you're excited, but there's still a lot of emotional ups and downs. If you have to go through radiation, you're still a cancer patient. You don't have all your hair back. You still look like a cancer patient. If you're like me and still have infusions to do, you're still a cancer patient. So even though you're cancer free, you're still a cancer patient. And that can be emotionally upsetting. Some days are better than others, obviously. I try to keep a positive outlook, but just realize if you're going through that or if you have a loved one that's going through that, be patient with them. Be patient with yourself because it's not like, oh, everything's all happy. There's that kind of feeling of waiting for the other shoe to drop. You can't believe, one, that you even have cancer, and then everything's going good and you're cancer free. You're kind of scared. You're kind of leery of things, especially nowadays with like COVID and stuff. The last thing you want to do is get sick. So there's a lot of emotions going on up and down, a lot of emotional roller coaster, and that's okay. That's normal. I would advise anyone who is going through this to reach out to your local breast cancer foundation support groups. And even if you don't meet them in person, like me personally, I was assigned a mentor, and I can call her up when I'm, having questions or feeling a certain way. And it is really, really helpful to have someone who has actually gone through it themselves to give you that support. Family and friends are great. Of course, you need those. But unless they've gone through it themselves, there is no possible way they can truly understand your mental status and your physical well-being and how long it takes to recover from chemo. I haven't had chemo for, let's see, December, January, for 3.5 months, but I'm still recovering from what my body went through, and that's perfectly normal. The nurses and doctors tell you it could be 6 months to a year before you feel like yourself, maybe a year and a half for some people. So everyone's different. So yeah, if you're going through this treatment and you have cancer, reach out to your local cancer foundation groups and get the support. Get somebody that you can call and talk to. And again, if you're a family member, just be patient with your loved one because it's saying it's hard or it's difficult is the understatement of the year. But in my case, things are going good. I try to stay positive and try to be grateful for even the small things every day. So that's about it. I am hoping I can get one of the nurses or technicians today to do a short little video of me ringing the bell by the radiation department. So be on the lookout for that if I can get somebody to do that for me. All right, thanks.